The top stories tonight in Y News. COVID-19 vaccine shortage hits COVAX facilities around the world.
The Department of Health has begun the process of filing the application for emergency use authorization of Sinopharm's COVID-19 vaccine.
A Caloocan City resort owner faces charges over viral quarantine breach. Malacanang hopes na yung Filipino Foundation won't hinder the construction of a vaccination hub.
Fungal infection targets recovered COVID-19 patients in India.
And NASA criticizes China as largest rocket debris falls back to Earth. Good evening, Philippines and the world. Today is Monday, May 10, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Pino.
First in the news. The first shots of COVID-19 vaccine to as many as 60 countries might be impeded as the deliveries through the COVAX program is facing a delay. Queenie Rivera will give us the details live. Yes, Queenie.
Harleen, COVAX health campaigners have now called for attention on the crisis of vaccine shortage around the world as the Serum Institute of India fails to deliver the promised dose and putting pressure on the global COVAX scheme of reaching out to the world's poorest countries. The Serum Institute of India is one of two of the producers and providers of the scheme of the AstraZeneca vaccine for the global COVAX scheme, on top of being the largest vaccine manufacturer in the world. The other COVAX manufacturer, SK Bioscience, is a South Korean firm teaming up with a Swedish company. However, as India continues to get overwhelmed with the surging COVID infection cases, the country was forced to place a ban on material and supply exports, causing a significant delay in the manufacture of the COVAX vaccine doses. Health campaigner Global Justice Now said that the over-reliance on the SII was also a factor affecting the worldwide vaccination scheme. The three major leaders in the COVAX project, Gavi, UNICEF, and the WHO have since acknowledged that vaccine deliveries from the SII will not be fully relied on from this time, and that they will now look at expanding the manufacturing of the AstraZeneca or SK Bioscience stream. Gavi, a vaccination promotion alliance, suggested that countries who have been well on track with their vaccination programs and have excess vaccine supplies should share them with the COVAX project so that the scheme can continue to reach out to the poorer populations. So far, the project leaders have already struck deals with a number of manufacturers to better source vaccine doses. Additionally, countries including Sweden, Spain, France, Norway, UK, and New Zealand are currently in talks with the COVAX officials to determine the exact plan of supporting the global vaccine share. Back to you, Harleen.
Thank you, Queenie Rivera, reporting live from Singapore. The Department of Health is set to file an emergency use authorization application, or EUA, for the COVID-19 vaccine manufactured by China's state-owned drug firm Sinopharm. This is not the first time that the DOH has applied for an EUA for new technologies such as vaccines. Aiko Miguel will tell us why.
The Department of Health is now completing the documents needed for the emergency use authorization application of Sinopharm COVID-19 vaccines. Health Undersecretary Maria Rosario Vergara stresses this move is nothing out of the ordinary. This is still in line with the regulatory process of the Food and Drug Administration, Undersecretary Vergara adds.
Hindi lang po ito yung unang pagkakataon na mag-a-apply ng EUA, ang DOH, para sa mga new technologies like these vaccines. We have done this for the COVAX facility. Ginawa rin po natin ito para sa mga donasyon na bakuna from China, yung Sinovac. Of course, everything undergoes the strict regulatory process. We have policies to support that DOH also can apply for this EUAs. We are not going to represent any manufacturer for that matter.
According to the DOH, once Philippine FDA grants an EUA to Sinopharm, the transaction for the supply of Sinopharm's COVID-19 vaccine in the country will be between government to government. This means the Philippine government will no longer have to transact with the vaccine manufacturer.
So when you say it's government to government, it's like the donations, no? Pag sa donasyon, sasabihin ng isang gobyerno abroad o magdo-donate ako sa inyo, kami na ang mag-a-apply para doon. Walang manufacturer na kasama dito, no? Gobyerno doon sa ibang bansa ang kausap namin. And this is the pathway na tinitignan namin ngayon for Sinopharm. Baka pwedeng dito na rin kami dadaan, mas magiging mabilis ang proseso.
The World Health Organization authorized China's Sinopharm COVID-19 vaccine last May 8. According to WHO Director General Tedros Adhanom Ghebreyesus, Sinopharm being included in WHO's Emergency Use Listing or EUL will expedite the regulatory approvals for Sinopharm. Sinopharm is the first COVID-19 vaccine included in WHO's EUL from a non-Western country. Other COVID-19 vaccines in WHO's EUL are Pfizer, AstraZeneca, Johnson & Johnson, and Moderna. The DOH is confident that Sinopharm's COVID-19 vaccine is safe and effective, having a green light from WHO for its use. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, President Rodrigo Duterte is expected to announce this week the new community quarantine classifications to be implemented from May 15. The National Capital Region or NCR, Bulacan, Cavite, Rizal, and Laguna collectively tagged as NCR Plus are under Modified Enhanced Community Quarantine or MECQ until May 14 or 4 days from now. Presidential spokesperson Secretary Harry Roque said the Interagency Task Force for the Management of Emerging Infectious Diseases has yet to submit to President Rodrigo Duterte its recommendations on the new quarantine status. Secretary Roque added that based on the current data on the healthcare utilization rate and the COVID-19 situation in the country, there is a possibility that the community quarantine status would be eased in the NCR Plus. However, the palace official said the decision rests with the IATF on whether or not to shift to the NCR Plus to a less restrictive community quarantine level. There has been a decrease in the COVID-19 reproduction rate in the National Capital Region Plus bubble after the implementation of strict lockdowns. However, the UP Octa Research Group says that the government should extend the current Modified Enhanced Community Quarantine or MECQ for one more week. Marvin Callas explains why.
Before, the average new COVID-19 cases reaches 9 to 10,000, but now it's significantly lowered to 6 or almost 8,000 cases. Nevertheless, the Octa Research Group still doesn't recommend National Capital Region Plus to switch its status to general community quarantine. Experts explains that the utilization of intensive care units or ICU are still in its critical level and the need to lower the occupancy rate in hospitals is indeed necessary. In addition, the average daily attack rate and positivity rate remains high as a result of increased positive cases of COVID-19.
We'd like to remind everyone that the trends are still reversible, no? Hindi pa din ito when we say going down steadily, no? Hindi siya definite na pababa na. At any point in time, maaaring tumaas pa rin ito. But the indications in the NCR Plus bubble are generally generally for the past few weeks are going down.
Yes, we are healing. Yes, we're trending in the right direction, but we're still not yet there. We can understand, no, if government will have discussions about extending the MECQ, really because we need some more time to heal. We also need some more time for government interventions.
Expert suggests an MGCQ extension for 1 to 2 weeks, adding that a slow exit strategy is needed not to spoil the good record for the past weeks. The group hopes for a continuous downward trend that may lead an average 1,900 cases on May 14 on the duration of current MECQ status. The group also anticipates that the critical level situation on hospitals will lower on the next few months and additional healthcare workers would be addressed by the government. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines logged 6,846 new COVID-19 cases today, pushing the total count to 1,108,826. In its 4 p.m. bulletin, the Department of Health reported that the number of active cases went down to 59,897. Of those active cases, 93.7% are mild, 2.2% are asymptomatic, 1.7% are severe, and 1.3% are in critical condition. The DOH noted that 5 laboratories failed to submit data on time. The agency also reported 8,193 new recovered patients, bringing the recovery tally to 1,030,367 individuals. The death toll climbed to 18,562 with 90 new fatalities.
Charges will be filed against the owner of a resort in Caloocan City for violation of the community quarantine rules when the establishment allowed a large crowd to go on a swimming activity despite the government's restrictions on mass gatherings, while the MECQ is enforced within Metro Manila. Asher Cadapan Jr. reports.
Philippine National Police Chief Police General Guillermo Eleazar explains that while the mass gathering incident in Gubat sa Ciudad Resort in Caloocan City serves as a lesson and warning to everyone, it should be prevented from happening again. With this, the owner as well as the barangay officials should explain why it happened.
Well, they have to justify bakit hindi nila bakit nahayaan na mangyari yan. Well, but of course, these are part of the investigation. When we say we will file case, of course, we have to investigate first.
Caloocan City Mayor Oscar Oca Malapitan, however, confirmed that criminal charges are being prepared by the city government against the resort owner. The chairman of the barangay, on the other hand, may also be held liable in the said incident.
Sinusulatan namin ngayon yung barangay captain at hinihingan namin ang kanyang paliwanag. Depende ho doon sa kanyang sagot.
But Barangay 171 Chairman Romy Rivera denies negligence on his part, explaining he has even reprimanded the owners just recently. The barangay official said he will only defend himself if a case against him will be pursued.
Handa naman po ako kasi alam ko naman po, alam naman po ng Panginoon na walang kasalanan dahil po ginawa ko naman po, hindi naman po ako nagpabaya. Pinahuli ko po nga yung naliligo. Ang may kasalanan, yung bantay at yung may-ari, sila ang matigas sa ulo dahil kakasuhan ko rin po yung may-ari.
An extensive contact tracing, close monitoring, and RT-PCR testing of all individuals present at the resort on the day of the event will be launched. Asher Cadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Last week, President Rodrigo Duterte ordered the apprehension of people who are not wearing or improperly wearing a face mask in the country. Now, newly installed PNP Chief Police General Guillermo Eleazar orders his men not to detain such violators after their arrest. Rhea Ilagan reports.
Philippine National Police Chief Police General Guillermo Eleazar orders policemen on the ground to arrest those who will be caught violating anti-coronavirus protocols such as not wearing a face mask. But he also directs his men not to detain violators.
Walang makukulong dahil sa pagsuot lamang ng mask. Walang masasaktan walang mag-exercise, walang ipahihiya.
The new PNP chief also emphasizes that penalties must be enforced according to existing local ordinances.
Kung ordinansa is magmulta, bigyan ng ticket. Community service, schedule kung paano man yan. Then bandang huli, gusto nyo kasuhan, pero pauwiin nyo rin.
Eleazar adds, if the violation is not wearing a face mask, then the violator must be given a free face mask.
Bago nyo dalhin, dahil ang violation niyan ay non-wearing of face mask, bigyan nyo ng face mask. Ang ating DL ay magdidistribute ng mga face mask. Kung wala naman, iniintay pa natin ang mga donation, mag-effort na rin kayo. Maghanap kayo ng face mask na ibibigay nyo sa mga huhulihin nyo.
There must also be close coordination between the police and the local government unit for the holding facility where arrested violators will be brought to.
Ang bilin ko sa inyo, ang bilin ni Secretary Anyo, bago kayo mag-arestuhan, tingnan nyo muna kung may paglalagyan kayo sa inyong opisina. Dahil ang ayaw naman natin, arrest sa inyo yan, kumpul-kumpul lang pa doon. So, coordinate with your LGU and barangays, magharap kayo ng mga lugar kung saan pwedeng dalhin yan.
Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.